Welcome to Elevate. I'm Rachel and this is Nikki.
Hi, Rachel.
We're here to bring you the best insights from local wellness experts, helping you elevate your health one simple step at a time.
Don't forget to sign up for our newsletter for curated wellness tips. You can watch this episode on YouTube or Spotify or listen on Apple Podcast at Elevate Wellness.
On this episode of Elevate.
When I think about the reason why more people are not familiar with red light therapy as an example, but more importantly, strongly considering a therapy like this, it goes back to what we said just a few minutes ago, like this notion that red light therapy is voodoo medicine, or in some cases, the term holistic doesn't always resonate positively with people. And so they think that we're kind of performing some hocus pocus on them, and it's an illegitimate type of therapy. That could not be further from the truth. This is something that has been studied so widely for more than 50 years. This is a therapy that has been available as a tool to medical professionals. It just hasn't been fully adopted by the US healthcare system. And I think we could go into a totally different conversation about why that is, but we'll leave that for another time.
In this episode of Elevate, we are excited to have with us Pete Cousins, co-founder of Laser Lab Emeralds Inlet, a wellness studio dedicated to helping people recover, restore, and perform at their best through the power of red light therapy. Pete shares his inspiring personal journey from patient to practitioner and how his own healing experience sparked a passion for bringing innovative, non-invasive recovery technologies to the Grand Strand community. Laser Lab was built on the belief that the body has powerful natural healing abilities. Through advanced science-backed therapies, Pete and his team focus on improving mitochondrial health, accelerating recovery from acute and chronic conditions, and even supporting pre- and post-surgical healing. In this enlightening conversation, Pete explains the science behind red light therapy, its broad applications for health and performance, and why focusing on health span, not lifespan, is the key to living well. His story is a testament to the power of combining technology, education, and community to elevate wellness in meaningful, lasting ways. Let's get started.
Welcome, Pete, to Elevate. We are so incredibly excited to have you on this morning.
Thanks so much, Rachel and Nicole. I appreciate you having me.
Absolutely. This is going to be an exciting interview today. Thank you.
Absolutely.
You are the co-founder of Laser Lab Emeralds Inlet. I'd like to start with your story and what inspired you to open up your practice.
So it's a very simple story. I became a patient, and I also became affiliated with our exclusive manufacturer partner for the technology that we use at the clinic. And so my story was pretty simple. I had a tennis elbow, and I'm a fairly avid weekend warrior, playing tennis and golf and all different kinds of sports. So I had this nagging injury that had been going on almost 2 years. And I discovered this therapy, which most people know as red light therapy. And we'll touch on that, I'm sure, as we go through. But when I discovered this, I said, well, let me give it a try. I had tried injections. I had stem cell injections. I had cortisone injections. I tried physical therapy. Nothing would give me any pain relief until I started using this non-invasive laser therapy. And by the time my symptoms were gone, which took roughly a few weeks, I was, kind of opened up to the idea. So I started looking deeper into it. And as it would happen, I got connected with the manufacturer of the equipment that we currently use. So we'll touch on that in a little bit, but I got connected, and then I actually became the head of commercial operations for that company. And so that really gave me some deep insights as to what this technology can do for people. And it just continues to this day now. It's been almost 5 years. I'm still astonished by what this can do. So that's my story. I actually was, I was using this before I became the practice owner and started promoting this in the community.
That's a very quick recovery considering what you had gone through before with your injuries.
It really, really was. When you understand what this technology does, I can boil it down and make it very, very simple. There's specific colors of light that will absorb through the skin, and it causes our cells to react in a positive way. And they basically become more excited and more efficient in their function. So the body heals itself more quickly. and more effectively. I mean, that's as simple as I can make it. And I know as people look at this on the surface, sometimes causes them to be a bit skeptical because it is non-invasive. You cannot feel it. There is no risk for injury. There is no lifestyle adjustment. There is no downtime. It truly is something that can be done impromptu. My therapy for my tennis elbow took about 4 to 5 minutes. So the treatments are relatively quick. And when you add all this together, it naturally stimulates some skepticism. People say, well, come on, there's no way something like that that's so non-invasive and so easy to do can possibly have the outcomes that we talk about. And when they experience it for themselves, I love having a new patient into the practice and they have that first aha moment, the first time they actually get the pain relief, and then it becomes durable. Their eyes are opened and they become, I hate to say a believer because this is not a religion, this is science, but oftentimes we have people that completely change their tune once they've experienced the benefits. So it's just such a rewarding thing to do for people.
That's great. It does come off as sounding a little woo-woo, I'm sure, for some people, but I am a total believer in the red light therapy. I actually have a mask that we just purchased for
Super.
all the reasons.
Super.
So I think you should take us back, though, and go into details of what is in the Laser Lab, the technology that you're using, so that our audience will understand. We don't want them to be woo-woo anymore with this, Pete.
Fantastic. Let's talk specifics. So we have a few different therapies that we use. The primary or core competency that we have is what's called a class 4 laser. There's a mouthful, a term that's used to describe what we do. And red light therapy is kind of the well-known phrase within the consumer space. The actual term, this is a mouthful, it's called photobiomodulation. And essentially all that means is we're using light, that's photo, to stimulate cells, which is bio, to cause change, which is modulation. So when we use this therapy, it's a handheld device that has 4 different types of laser energy built in. So all 4 are being used at the same time. And we have very specific protocols for each and every body part and thousands of different potential conditions, painful symptoms, and things that people are dealing with. So we effectively just have a consultation. We will evaluate their situation, and then we will find the right protocol to use, and we'll prescribe a treatment plan. So again, these sessions are usually less than 10 minutes in length, so they're very quick. There's a few treatments that may last longer than that, but on average, they're very short. And we effectively just place the end of the handpiece onto the affected tissue and move it in motion around that area for the prescribed amount of time. And we do this usually 2 to 3 days per week. And most conditions will respond quite readily within a couple weeks. We'd like to see somebody for about a month. And typical treatment plans will be in the range of 10 to 15 treatments, and then they'll get relief. And the relief is not transient. The relief that they get is typically very durable. So that means when you get the result you're looking for, it tends to last. In some cases, it's good to go and it's a permanent fix. If there are things like overuse injuries, which we experience when we play sports, for example, that may be aggravated once again, and down the road, their symptoms are coming back, we can do touch-up treatments and get them back in good shape. So that's our primary tool that we use probably 85% of the time. Our second therapy is called LED bed therapy. And again, most people refer to it as a red light bed. It's a very large contraption. It looks like the old tanning beds back in the day. It definitely is not tanning anyone. This is using strictly the positive red light therapy and the same wavelengths that we're using in the laser. It's just a more kind of gentle application. So patients will lay in the bed. It obviously exposes the entire body to this healthy light energy. And this can be used for more widespread kind of chronic issues. Maybe we're talking about widespread arthritis. Maybe we're talking about fibromyalgia, which is a very challenging condition for a lot of people. There's something called chronic regional pain syndrome, which is also quite prolific throughout the whole body for some people. And the bed is just a much more efficient way for us to treat such a large area. The fringe benefits of the bed therapy can be quite profound for people that are having difficulty sleeping, for example. Bed therapy can help regulate their circadian rhythm so they sleep more effectively. People may have issues dealing with anxiety or seasonal depression and things that typically you wouldn't think of using red light therapy to help. But there have been numerous studies that show regular use of something like our red light therapy bed can also help people with mood regulation. So there's all kinds of other benefits that can be had when you're using the bed therapy on a regular basis. That tool is used mostly on a membership basis. So once people come in, if they have a particular need where we'll use the laser, they may decide to stay with us and engage with a monthly membership so that they can continue to use the bed therapy whenever they want. And most people use that, 2 to 3 times a week, very similar to the laser. So
That
those are,
sounds amazing. I would
yeah,
love to get in that bed
please,
therapy.
you're welcome anytime, anytime.
So
I'm
it
sorry.
addresses both acute and chronic conditions, correct? Pain, non-invasive recovery, as well as, and you answered my question because I was sitting here thinking of additional benefits, right down to sleep and anxiety. That's very interesting and covers a diversity of things. So it's, preventative, holistic, and it's also good for the chronic conditions as well.
It is. And I didn't touch on this, but I should mention we see so many people who have just undergone joint replacement surgery. If you or anyone you know has been through a knee replacement, a shoulder, a hip, these can be obviously quite traumatic surgeries. And for certain populations, they have a very difficult time recovering from that surgery, even going through the proper physical therapy protocol. So we have actually partnered with some physical therapy clinics locally in Emeralds Inlet to actually combine their therapy with our therapy. And what we'll find typically, let's take knees, for example, they tend to be one of the most challenging recoveries for one primary reason. The physician needs access to that joint and they have to cut through a lot of connective tissue surrounding the knee joint to get in there and put the joint replacement in. So the recovery can be very, very lengthy and kind of painful and difficult for the patients. So when we use laser therapy, we're both helping them with the pain they're experiencing. We're helping the body to move through the inflammatory process more quickly so we get that inflammation out of the equation faster. And then last but not least, we stimulate those cells to do their job, which is to heal much more quickly. So we see people sometimes recovering from things like knee surgeries almost twice as fast as normal. And it's quite profound. So there's another whole application for post-surgical use, which is a really great use of the tool.
Pete, what about pre-surgical? Pre-surgical. So have you seen there is a benefit to patients coming in prior to rotator cuff or knee surgery? Because those are very invasive. Post-surgical knee is very, very painful. Many patients are not expecting to go through the recovery process that is required of them. And so sometimes they seek physical therapy, rarely, but they sometimes seek physical therapy prior to going through surgery. Have you seen benefit for them to come to see you prior to going through their surgery as well?
Great question. And the answer is absolutely yes. We have something which has been studied in the literature called tissue preconditioning. So very similar to going through some physical therapy prior to a surgical intervention. Doing red light therapy leading up to a surgery is essentially just nourishing all the cells. And so they're primed and they're ready to do their work more effectively, as we talked about. But in this case, we're kind of proactively doing it so that when the surgery occurs and that last suture is placed, those cells are already activated and they're working more effectively. So absolutely, that can be a great course of action. Usually we would see someone within a few weeks prior to the surgery date, and then they would go through the surgery and we would immediately try to pick up therapy once again as soon as they're ready for their physical therapy.
I just have to say right here, anyone listening that is considering going through surgery, rotator cuff, knee especially, or you have a loved one that is, if you can get ahead of it so that the recovery is better, that would be wonderful. I'm thinking like my whole PT brain for my physical therapy years just lit up speaking with you. So Nikki, I apologize. I'm like jumping in here going, what about this? What about that?
Yeah. No, that's
Uh,
good. Our audience needs to hear that. That makes perfect sense. I mean, my mother had both of her knees replaced and hips. And so as I'm sitting here listening to you talk, Pete, I'm thinking this could have made such a difference in her recovery. She did
Mhm.
well, but imagine how she would have recovered or been prepared for her surgery had she seen you first and gone through the red light therapy, as it's commonly known as, in advance. I mean, what a
Mhm.
difference that would make in our overall health and well-being. And if I'm not mistaken, isn't knee replacement like the number one surgery that's done in this country? And goodness gracious, how they could benefit from you.
It really is. And I couldn't agree more with you. I think one of the other factors, which certainly only applies to certain portions of the population, but it's very important to note. When someone gets to the point that they need a joint replacement surgery, in most cases, not all, but in most cases, we are dealing with a population that may have already become more sedentary. It may be because they're older, but it also could just be the fact that they're dealing with so much discomfort leading up to the surgery that they've now started doing less and less and less activity. When that happens, there's a whole cascade of events. Muscle tissue will tighten up, connective tissue gets quite brittle, and flexibility becomes the first issue. Then you have compensation, which means if there's a joint that is painful, let's say it's my knee joint on the right side, I will start compensating by walking with a different gait or a different posture. This can sometimes
Mm-hmm.
exacerbate
Yes.
the issue in the particular joint. So you've got that going on. And last but not least, this is another technical term, but I think most people are starting to hear this more frequently. Mitochondrial dysfunction is the term. So the mitochondria are, here's our quick science lesson. Mitochondria are effectively the powerhouses within every cell in our body. They are the engines that take in the fuel, right? If our body converts food, for example, into energy, the mitochondria receive the energy and then they will power the cell to do its job, whatever job it has. Over time, as we get older and as we become, let's say, less healthy overall, our mitochondria become sick. And this is, believe it or not, this is actually the root cause of most of today's chronic illnesses. And I'll start with the one at the top of the list, diabetes. There's a whole cascade of events that are happening when our mitochondria get sick and our cells can't do their jobs effectively. So this is what's happening to a lot of patients that are leading up to joint replacement surgeries. And if we can help kind of reverse some of those challenges before they go through that procedure, yes, coming out the other end, they'll have a much better experience. They'll hopefully recover much more quickly. But the most important part is that they recover fully. I met someone last week actually on the golf course, and she had had a knee replacement and she could barely flex her knee halfway to fully flexed. And she had just accepted the fact that that's how her leg was going to work from now on. Well, that's a shame. And, you know, had we been able to intervene, I would think there's a high probability that we could have helped her get to full range of motion. The benefits go on and on and on. And I don't want this to be too much of a science lesson, but it's important for people to know what they're facing and how they can overcome these challenges.
Hi, friends. You know, Elevate is all about connecting you with the best local wellness experts, and we couldn't do it without our amazing sponsors like Laser Lab. If you've been curious about red light therapy, this is your sign to finally give it a try. Laser Lab helps your body do what it's naturally designed to do: heal, restore, and recover using the power of light. Whether you're dealing with inflammation, slow recovery, chronic pain, or just low energy, red light therapy supports your body from the inside out. And here's the best part. For our Elevate listeners only, Laser Lab is offering an Experience the Light consultation. Your first session is free when you mention Elevate or use the code PODLIGHT at booking. Visit laserlab.com/podcast or stop by Laser Lab in person and tell them you heard about them on Elevate. Your body will thank you.
We're so grateful for our local wellness expert and sponsor, Dr. Sarah Salander, owner of Balanced Physical Therapy and Wellness right here in Myrtle Beach. Sarah is a women's health and orthopedic physical therapist who helps active women, especially moms, feel strong, confident, and capable in their bodies again. She knows that just because something is common doesn't mean it's normal. Whether it's leaking, pressure, or back or hip pain, or feeling disconnected from your body, there are real practical solutions that fit real life. At Balanced Physical Therapy and Wellness, Sarah takes a whole person approach, combining physical therapy, strength training, education, and lifestyle guidance so women can get back to the activities they love without fear or pain. Listen, this is a concierge physical therapy practice. She offers the highest quality, personalized one-on-one visits and progressive care designed to meet each woman's individual goals and lifestyle. Exclusive for Elevate listeners, get access to a free downloadable for a 10-minute body readiness check. It's available in our newsletter. Sarah will guide you through how to assess your core, your strength, and movement, and help you discover your next best step toward feeling strong and confident in your body again. Balanced Physical Therapy and Wellness is helping active women move better, feel better, and live healthier across every season of life. So visit the show notes to connect with Balanced Physical Therapy and Wellness and start feeling at home in your body again. Now, back to our conversation.
Well, I think the problem is they don't know that this is available, and we've come to accept traditional medicine as the only way. And we know in the health and wellness space now, that's not the only way. And if we can get more people to know about what you're offering, Pete, those devices that are available to us, it can change the trajectory of your lifespan. And into what we need to be thinking about now is not just living longer, but living well. You know, you want to go strong until the very end. You don't want to just decline for years and years and years. And that's where we have to be thinking about the different modalities that are out there. And that's at the Laser Lab. Unfortunately, the message is just not getting out there as quick as we need it to be to help that lady that you saw on the golf course, because it could have been true game changer for her had she met you beforehand and been able to see you and what you're doing prior and post her surgery. And that's
100
what we've got to let people know.
100%. And the term that comes to mind, Nicole, is health span. We talk about lifespan, and certainly everyone would like to live as long as possible. But more importantly, they would like to live in a state of health, as opposed to a state of decline. So this is what's referred to as health span. It's becoming, I think, more of a buzzword as we realize what, like you said, what options we have available. When I think about the reason why more people are not familiar with red light therapy as an example, but more importantly, strongly considering a therapy like this, it goes back to what we said just a few minutes ago, like this notion that red light therapy is voodoo medicine, or in some cases, the term holistic doesn't always resonate positively with people. And so they think that we're kind of performing some hocus pocus on them, and it's an illegitimate type of therapy. That could not be further from the truth. Right. This is something that has been studied so widely for more than 50 years. This is a therapy that has been available as a tool to medical professionals. It just hasn't been fully adopted by the US healthcare system. And I think we could go into a totally different conversation about why that is, but we'll leave that for another time. I think that the fact is, when people realize that this is well studied, this is very validated, and it truly does change people's lives, they just need to either know someone who's gone through the experience or experience it for the first time themselves to really have that light bulb moment and really start to open their eyes to these other options. And you're exactly right, Nicole. When I get sick when I watch TV these days and all I see is pharmaceutical advertisements, constantly thinking that there's a pill we could throw at any symptom we're dealing with. And that is not the way we should think about it. We should think about what's the root cause of my issue? How can I address that in the most natural way possible and get the most effective outcome so my health span improves? That's really, in a nutshell, how we should be thinking about taking care of ourselves, especially as we age.
Yeah.
Pete, I know community is important to you as well. You shared that your clients and patients are like family. How do you support your community in that respect as a family, following their time with you and receiving their, 10-minute session?
Yeah, it's a great question. My wife and I, Tamra, who runs the clinic day to day, we sat down recently to think about what is our superpower? Why would somebody come and see us? Because transparently, there are a number of different providers in the Grand Strand that have the same therapy that we do. We are one of only two that has the bed therapy, but there are probably 10 or 12 providers that have the laser therapy. We thought about, why would somebody come and see us as opposed to someone else? And it really is the fact that we create this family type of feeling. When you come into our clinic, you do not feel like you've stepped into a medical facility in any way, shape, or form. We have a very inviting, kind of relaxed environment, and we get to know people and spend abundant amounts of time with them to really get to know them. Even though the therapy is only 10 minutes, oftentimes we'll have people stick around after their therapy and spend another 20 or 30 minutes just chit-chatting with us. And when we can fit that into the schedule, we always take the time to do that. I think in today's healthcare experience, as a generalization, I'll say, we oftentimes get shuffled into the doctor's office and we get shuffled out quite quickly. I think we would all agree with that. We take the time to get to know our patients. This kind of spills over into time away from the clinic. So we actually make it a point to stay in touch with people when they leave the clinic. We do the simple things like we recognize milestone birthdays and anniversaries and things like that, which just show that we truly care about the people that choose to do business with us. But from a community standpoint, we're working hard to get out there into the different segments of the population who could benefit the most. So for example, we sponsor a few different tennis clubs around town, Prestwick Tennis Club and Stables Tennis Center in Pawleys Island, the Litchfield pickleball group. And so we're trying to get ourselves into those kind of populations where people we know could benefit, but we're also supporting those local businesses. We do offer some extensive discounts for first responders, for healthcare providers, for educators, for military members, both active and retired. So we're really trying to be easy to work with and get ourselves in a place where people feel welcomed and they want to come back. We do have a lot of people that have now stuck with us for over a year and a half. And oftentimes they'll joke and say, I feel like if I'm not here, I'm like missing a family visit. So they come back. We love that.
That's very complimentary to what you and your wife are doing. I know that's wonderful to get that sort of feedback. You've talked a lot about sort of the more mature folks in the area. Is there an age that one can start using the therapy? Let's talk about how early can one benefit from this? What might be a situation where they would benefit from it? Mm-hmm. And take us through, younger all the way up to the more mature numbers.
I would be happy to. And my story about how young you may be when you start this therapy, this is true story. I was in California visiting with a dental provider. This is actually widely used therapy in the mouth. And there are a number of benefits to be had, which we could go into. However, there's an issue that a lot of newborn babies face. Everybody knows what a tongue tie is.
My granddaughter had that.
Okay, so if a newborn is dealing with tongue tie, it can make it extremely painful for the mother to breastfeed. And so there's a whole segment of the dental provider community that will do what's called a tongue tie release. Whether they use a scalpel or they use a more invasive laser, they'll cut the tissue under the tongue so that it provides relief for both the child and the mother. So I was introduced to this dental provider, and she exclusively had a practice doing tongue tie releases. So we brought the laser in, and I actually have lasered 10-day-old baby in the mouth, because what we were able to do is, again, help that tongue tie release procedure become more effective and more comfortable. The reason is oftentimes when babies have a tongue tie release, it tightens right back up. And so when using laser, it will prevent that scar tissue formation so that the tongue tie definitely won't tighten back up, and they get a better outcome. So you can use this really as soon as you're out of the womb, and there's a good use case there. But also sometimes new babies deal with what's called torticollis, and this can be where their neck is kind of in a more tonic state where it's kind of off to one side. And we've lasered babies' necks and shoulders to help relax that condition for them. So that's on the young end of the spectrum. Then we can go to the other end of the spectrum. And we have had a patient at our clinic in Emeralds Inlet who is in his 90s and still quite active, just dealing with a lot of joint pain. And so we've treated him for arthritis of the shoulder and of the knees, and he's had great result. So there is no age that you couldn't do this. There are probably within that age range, there must be 1,000 different painful conditions that I could name, which could respond to this therapy. So when I say this is something that can be used head to toe, I am actually not embellishing. Once again, what does that do? That stimulates skepticism. And people say, come on, you cannot possibly use this on all these different things. And if I just quickly go through the body, we've helped people who are dealing with very sensitive nerve tissue on their scalp to get relief from something like that, to someone who's dealing with TMJ pain in their jaw, ringing in the ears. We've had patients with open wounds that are not healing properly for various different reasons. This does an amazing job at closing wounds more quickly. We can talk about basic muscle strains or sprains. We talked already about joint replacements and what this can do pre and post surgically. Arthritis anywhere in the body, but most importantly in the spine. Anytime there's any kind of inflammation around any of the vertebrae in the spine, pressure gets put on the nerves, which then presents itself in the extremities. So we can help with that. I mentioned diabetes. One of the most prolific treatments we have is for diabetic neuropathy. Neuropathy is essentially just a disease of the nerves. And again, without going into a science lesson, those with diabetes know that if it's progressed enough, they don't heal properly. They oftentimes have a lot of trouble with their lower extremities, starting in the feet. And it progresses quite readily if they don't take care of themselves. But this therapy, we have literally prevented amputations for people. We have helped those who have gone through a surgical or a trauma-based amputation, because there is also neuropathy present with those who have lost a limb. So we can help with that. It just goes on and on and on. So, we're so excited to talk to people and just hear their story. And I know that we'll find a way to help them, because there's an application that's been studied and been proven, and we can deliver.
Pete, I had no idea how many ways in which red light therapy could help individuals. This is so incredibly exciting and motivating to share with our community, from young expecting moms, right? And families, all the way through the generations, from acute to chronic. I'm sure athletes as well. That's just incredible. And I was thinking migraines.
Oh, yeah.
As well. If this is supporting healthy mitochondrial function and cellular repair and recovery, why then wouldn't it, right?
We have a number of migraine patients who respond quite well. Now, I would say in a condition like migraine headaches, where we don't always know the origin, we can help people to lessen the severity and hopefully lessen the frequency. But if there's an underlying issue causing them, we may not stop the occurrence. So we do try to set very realistic expectations and help people not think that this will necessarily fix absolutely everything 100%. But it's a big piece of the equation. So some of the other thoughts that come to mind as you're talking is, number one, we try our very best to educate people around this concept of chronic inflammation. So we already talked about mitochondrial health. Well, chronic inflammation tends to be the byproduct of sick mitochondria, and this can proliferate in the body and present in numerous different ways. So when we can educate those about how they can do things outside the clinic to address chronic inflammation, it's things like proper supplementation if they get their blood work and discover that they're low in certain micronutrients. It can be using food as medicine and understanding the impact of the type of food and the quality of food that we eat. It obviously leans into fitness and exercise and the importance of getting the body moving. So there's all these different components that we spend time when people come to see us. We spend time giving them educational resources so they can go and discover for themselves, what else could I possibly do to help myself on this journey? And that's a really big part of what we do. The second thought that came to mind, Rachel, is yes, this is an amazing therapy. And I would be remiss if I didn't say that it's important to know how to use the tool. It's not as simple as you and I going onto Amazon and finding what looks very similar to the tool that I'm using, turning it on and thinking, okay, that's it. It's going to solve my problem. Right. The challenge is designing the protocol. So in this application, there's all these different variables that go into making a proper protocol for these different conditions. Our device, we exclusively use a brand called Summus. It's SUMMUS. Summus lasers are manufactured in Nashville, Tennessee. And I personally know the founder and owner of the company. So they do extensive and deep scientific research on their protocols so that they are built into our equipment. And that is really the secret to success, because some people do have experience with red light therapy and they may say, this was kind of lackluster. It didn't do much for me. It didn't get me to the point I wanted to get. That's because of the variables not being correctly set for their condition. So I can't stress enough how important that is, that you go to a clinic such as Laser Lab where we know precisely how to treat the different symptoms you're dealing with. It's not like a cookie cutter type of procedure.
Let's give a big thank you to one of our amazing Elevate sponsors, Brain Performance Training, led by local wellness expert Laurie Sampolo. After more than 20 years as a registered nurse, Laurie witnessed how addiction, anxiety, and PTSD impact families, including her own. That experience inspired her to offer neurotherapy as a holistic, science-backed way to help people take control of their mental health. At Brain Performance Training, the mission is simple: break the stigma and encourage everyone to seek the support they deserve. Healing begins when we reach out, and Laurie is here to guide that journey. Mention Elevate and receive 10% off a treatment package, including before and after EEG and 15 sessions. Contact Brain Performance Training at gmail.com or call 843-655-3325 to learn more.
Hi friends, have you heard about Ayurveda? It's the 5,000-year-old system of holistic medicine that brings your mind, body, and spirit into balance. Through personalized nutrition, herbal remedies, daily rituals, which I love, and gentle detox practices, Ayurveda helps you restore harmony and lasting vitality naturally. That just sounds good. We're so grateful for our local wellness expert and sponsor, Kerry from the Holistic Highway, a globally recognized leader in integrative medicine and Ayurveda. Kerry is transforming modern health by focusing on you, not just your symptoms. Through her personalized system that blends nutrition, lifestyle, and genetics, she's helping clients find lasting balance and vitality. The Holistic Highway provides a personalized system to manage chronic disorders by incorporating fundamental changes in diet, behavior, and stress while focusing on genetics. This individualized program is so successful that many of her clients have achieved maximum healing and vitality after years of chronic problems. Because there is no one size fits all in health, Elevate listeners enjoy a complimentary 30-minute consultation to discover your unique mind-body type and one actionable tip for better balance. So book through our show notes and mention Elevate to claim your offer.
Well, I don't think we would want a cookie cutter procedure if we're really targeting our issues, which is wonderful to reiterate and make our audience understand the difference of, like you said, just getting something off Amazon and just thinking, well, why do I still have headaches or whatever? There is a difference, and that's important to note. I was curious, can your, say, the LED bed therapy, can that be used as a maintenance tool in life to help with your inflammation? I mean, say I'm, quote, perfectly healthy and I want to come in and do the maintenance LED bed therapy that way. It will have the benefits for me lifelong, correct? And if so, talk about that.
Yes, it's a great question. The answer absolutely is yes. And Rachel, you mentioned athletes. When we think about this, so the red light bed therapy is now becoming widely accepted in professional sports organizations and high-level Division I college sports programs. For that very reason, Nicole, that when we lay in the bed on a regular basis, even if we're not dealing with any type of painful condition, it's a great way to keep ourselves healthy. And it's something that Tamara and I both do on a regular basis, at least twice a week. It takes about 15 minutes. And we always sleep better on the days that we do laser bed therapy. And we absolutely are working to keep our mitochondria as healthy as possible, keep them kind of nourished. A great analogy that I use with a lot of our new patients is simple. We all remember from science class back in high school when we learned about photosynthesis and the fact that plants require sunlight in order to perform any type of function they have. Our bodies are not so different. And if we can get exposure to healthy light energy, we will respond by behaving more efficiently and more effectively. You've all heard this, that one of the best things we can do for our health is to try and get a few minutes of sunlight within 30 minutes of waking up every day. That's not always easy for us, but it is extremely healthy for the body. And certainly overexposure to the sun is not healthy, but small doses, right? 15 or 20 minutes is so good for you in many different ways. The red light bed therapy kind of replaces that quick exposure to the sun. We do about 15 or 20 minutes and absolutely would love to see people who want to just remain in top condition and keep the body functioning well to come in and take advantage of one of our memberships. We have different membership levels where people can come just a couple times a week or 5 days a week if they love it. It's something that could be done that frequently. Oftentimes 3 is kind of the sweet spot. So doing this 12 times in a month is a great preventative type of course that you could take.
Out of curiosity, when someone comes in and they receive treatment, what does it feel like? Is it warm? Like in my mind, I'm expecting if you're going to go into the LED bed, you're going to lay there, you're going to feel warmth, or the treatment, do you feel anything?
Some patients will feel a little bit of warmth. I would say it's always mild. It's always comfortable. In the bed, it's actually very pleasant. If you've ever laid in a tanning bed, hopefully not, but if you ever have, then you'll know that gets quite hot, right? It's okay. I think we've all done it maybe once or twice. So in the red light bed, it is a little bit warm. I wouldn't go to the point of saying hot. We have fans to keep people cool if they are feeling warm. But the laser itself, you generally don't feel anything more than some warmth. Some people will report they feel almost like a tingling sensation. Again, it's actually positive because it's really reaffirming that something's happening. But that's it. Otherwise, you would never, ever know that you've had it done immediately afterwards. There's no visible result on the skin, and there's no precautions that you need to take ahead of time. Nothing special you need to do afterwards. So you can pop in, have therapy, and go right back to your lifestyle.
It sounds incredible. Mm-hmm. And I would want it to be a little warmer. I think that's when you actually just... it's almost kind of, you just fall into a different state of mind when you're in there. I would assume that it would be relaxing to some extent because of light is energy and we are all made of energy. So it sounds incredible.
It's a great point, Nicole. And the thing I would mention about that is the therapy was designed intentionally to be what's called non-thermal. So we don't want heat buildup for a reason. There's no need to build up too much heat in the tissue. Obviously, more heat can equal more risk. And so our devices are calibrated in such a way that they will never overheat the tissue. And you're exactly right. Sometimes patients will say, "Are you sure you have that turned on? I don't feel anything."
Mm.
And we would reassure them that's actually positive. This low level laser therapy is designed to be non thermal. We are definitely causing the reactions that I referred to earlier. So we know it's working. That's been proven for a long time. But we don't want it to get hot. We want it to be, as painless as possible, but almost to the point of not feeling it.
I think, unfortunately, we're in a society that says no pain, no gain. If I don't feel it, it's not working. If I'm not in the sauna dripping wet, it can't be on. So it's really trying to change our way of thinking about health and wellness, about practices that can heal us, can make us feel better, that don't necessarily require surgery, stitches, all the things that are painful. So it's interesting that it's taken us this long to get to this point, knowing this has been around for so long. But I'm glad that we're in this space talking about it, because it is so important for our community to know they have the options. They have something like this that can make their life so much better.
Yes, it's so true. And I would offer to all of your listeners, anyone who's curious about this, if you come to visit us in Murrells Inlet, we always give everyone a complimentary treatment so they can feel it for themselves. We'll do a full consultation where we'll really understand your story and what you've been struggling with, what your goals are, what you would like to achieve with this type of therapy. And then we'll start to talk deeper about some of the other things I mentioned: diet, exercise, supplementation, and just get a true understanding of the whole picture around someone's story so that we can then offer the right course of action. And if people want to take advantage and join the family, then we would love to have them. And if it's not right for them, that's okay. At least they learned a little bit more.
Yeah.
Hey, share with us the precautions and contraindications for red light therapy.
Sure. So we do have a few considerations, I'll call them, as opposed to flat out contraindications. That list is quite short. For those dealing with an implanted electronic device, let's say a nerve stimulator in the spine, anything that's battery operated, it could be a pacemaker on the heart, and maybe it's an insulin pump if somebody's dealing with diabetes. Those different things we have to be considerate of. And the way we're considerate is just not to treat in close proximity to those devices. For example, if somebody has a stimulator on their spine, that doesn't mean we cannot treat them. We may treat their knees and or their feet or their ankles, their hands, their arms. We just would not treat right on the spine. So kind of a precaution or consideration as opposed to a contraindication. For, let's say, medical legal reasons, if somebody is an active cancer patient, we have to be very, very clear that first and foremost, this light energy has been proven probably a dozen times over to be very, very safe. And the term is non-ionizing. Effectively, what that means is that this light energy will not cause disruption or mutation of any cells. So we know without question, this cannot cause cancer and this will not exacerbate cancer. But we also have to be considerate and make sure patients understand that we can't draw a correlation. So oftentimes if somebody's actively going through cancer, we'll think really hard and we'll talk with them at length before we decide to take them on. If someone is dealing with certain types of medication therapy, there may be, for example, certain types of medication that make us more photosensitive or more hypersensitive to light. And so those are, again, considerations or precautions where we might have somebody react a little differently because of that kind of photosensitizing medication. So we'll understand the full course of meds that somebody is taking before we kind of go forward. Also, those who are on really high doses of blood thinners, sometimes we will think hard before we treat those people, simply because laser therapy in certain cases is designed to increase blood flow. If somebody's dealing with blood thinners, we may not want to do that. We'll understand more before we kind of go down that road. And we certainly do get a full history on everyone so we know exactly what kind of medications they're taking. Outside of that, we really don't have to worry about treating people. There's no other real contraindications or precautions that we should take.
I think it's great to know that those considerations are there, and it is a testament to the thoroughness and how individualized the protocols are that you build for your patients.
For sure.
Are they do you refer to them as patients, clients?
It's a great question. I mentioned earlier when I talked about, kind of the environment that we create, and we are really categorized as a health and wellness clinic under the truest sense of the word. We are not practicing medicine. We do have a medical director, and Dr. Hinchelwood, who was a professor at MUSC and served in the Army, who now owns her own practice down in Bluffton, South Carolina. She and I got introduced through this therapy, and she uses the same therapy as we do, but she's our medical director, so she oversees the protocols, and that's really from a liability perspective. But the truth of it is, we are a wellness clinic, so I refer to our clients as patients because they're dealing with symptoms that we're trying to help them resolve, but they really, like I said, they really become family members more than anything. So
Yeah, it sounds like that's what you want people to know, that you are family and you're there to receive them and help them in every way possible. And taking the time to listen to them is really so important. People just want to be heard. And oftentimes when we're seeking someone to help us feel better, to address our needs, we have to be our own best advocate, because oftentimes as we're being rushed through a traditional doctor's office, we're really not being heard, and they're just dismissing a lot of the things that we know we're feeling. And so it's refreshing to hear that you get that and that you see them and you want them to know we're here to help you and we're going to listen and work through this. And we have something that just may do the trick for you. So that's beautiful to hear that.
yeah, it really is. And it's why we exist, because we truly want to help people. And we've seen it happen so many times now. In just a year and a half since we've opened, we've had over 500 patients come through our doors. And so it's quite rewarding. And at the same time, I think we may share this sentiment. There's some frustration around what I call our sick care system.
Yeah.
I think a lot of people have started to hear that term. What does that mean? That means that our healthcare system is designed and it drives the behavior that we will just throw medications, injections, or surgeries at somebody's problem, as opposed to truly digging in and trying to understand if we can help remove the root cause of the issue. And so it's more as if our healthcare system is like a Band-Aid, and we don't want to put a Band-Aid on things. We want to actually fix things so they don't need a Band-Aid. And that's not throwing stones at our healthcare providers in the community. They are absolutely essential, and it's not a knock against their expertise whatsoever. I think it's a system that's been designed, which we want to fit into and help people understand that we provide an option, and also let our healthcare providers know we work pretty hard, and it's not always successful, but we work pretty hard at getting introduced to the medical doctors in the community, starting with the orthopedic surgeons, going to the primary care and emergency urgent care physicians, going to the dentists, helping them understand that we would like to partner with them to help them help their patients in a different way. And it doesn't always get met with a warm welcome. Sometimes we get shown the door, and that's okay, because this is, I think, a disruptive type of technology, and it's not always going to resonate, but we do need to get the word out. So that's why we're so thankful to be on this show.
Yeah.
Yes, I can't wait to get the word out about Laser Lab. It's absolutely wonderful what you're doing for the community, and I know that our listeners are going to find so much value in what you're offering, from individualized protocol and considerations that you make and the diversity of benefits. It's just amazing.
Yeah, we're so excited. And so if anybody's looking for us online, our website is laserlabtherapy.com. And if you want to give us a call and just maybe talk about your situation before you come to see us, you can reach us at 843-376-9700. 9322. And we're there Monday through Friday from 8:30 in the morning until 5 at night. We do some appointments on Saturday, and then we are now exploring, actually today we have a meeting with a patient who's really not mobile. And so we're looking into now mobile services where we can come to you if you can't come to us. So
Ooh,
we're pretty excited
that
about it.
is wonderful.
Yeah.
Yes. Serving the whole 60 miles of Grand Strand on wheels. I love that, Pete.
We're going to try. We're going to try.
Yes, I love it. It's better than the sweet treats and the ice cream trucks. Here comes our Laser
That's
Lab.
for sure.
I love
That's
it. I
for
love it.
That's
Well,
good.
before we wrap up, can I ask my last burning question, Nikki?
Absolutely. It's a must.
Okay. In your experience, what is the one thing that our community can implement in their day to day to elevate their health and wellness journey? Something simple and tangible that maybe they can start doing.
The very first thing that comes to mind for me is a simple kind of, I don't want to say a hack, but it's a simple tactic that you can take with your food. If we're at the grocery store and you pick up any type of box of food or can of food, if you look at the ingredients and you can't pronounce any of the words on the list of ingredients, you should think really hard about buying that food. And the reason is that's a food that generally is what's called ultra processed. And ultra processed foods are absolutely like poison to our body. And so that's my simple trick for the day. If you can, find food labels that have very few ingredients and make sure you can pronounce all of them, you're in better shape than if not.
I love that.
Great advice.
Yeah.
Great advice. And simple. Makes sense. Makes sense, Pete. Gosh, thank you so much. This has been wonderful.
Oh, it's been a pleasure. I hope I can come on again. And we look forward to hopefully all of your listeners getting enough curiosity to give us a call or come and see us. So thank you so much for having me.
Absolutely.
Yes, thank
Thanks,
you.
Pete.
Have a great day.
Hi, friends. Please leave us a 5-star review and let us know what you thought of today's episode. Share it with someone who needs a little inspiration and tell them why they should tune in to Elevate, your go-to resource for healthy living here in the Grand Strand.
Each week, we're cultivating conversations that inspire well-being, support the ebb and flow of coastal living, and help elevate our community's wellness journey.
Don't forget to join our newsletter, a culinary garden of resources, including our downloadable Wellness Made Simple with curated tips from our local wellness experts. You can click on the link in show notes to subscribe.
And of course, stay connected with us on YouTube at Elevate Health Grand Strand and on Instagram and Facebook. You'll find those links in the show notes. We hope you enjoyed today's episode. The information provided in the Elevate podcast and associated materials is for general informational purposes only and is not intended as medical advice. No content should be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or treatment. Reliance on any information provided by Elevate, its host, guest, or contributors is solely at your own risk. We encourage you to consult with a healthcare professional before making any significant changes to your diet, exercise, or wellness routine. Ultimately, your health and well-being are unique to you, and it's important to make informed decisions based on your individual needs.